An aortic aneurysm is a fairly common disorder of the aorta, which is the major artery that courses behind the belly button. And in many patients who are over the age of 50 or 60, more commonly in males, there has been progressive ballooning of the aorta, resulting in what's called an aneurysm. For that reason, we fix aneurysm, we repair them. And traditionally, the method of repairing an aneurysm has been surgical for many, many years. It has been a very good procedure that has really stood the test of time. But of course, it's an invasive procedure. It requires an incision of the anterior wall of the abdomen, get to the aneurysm, fix it. It's a good procedure, as I've mentioned, but it carries some morbidity with it, and there's some risks obviously involved. And for those reasons, we've been seeking better methods to treat an aneurysm. And here at St. Luke's Medical Center, we've been treating aneurysms now with lesser invasive methods called stent grafts. A stent graft is basically a stent, which is a metallic tube, if you wish, that has a cover on it. And that particular device is inserted from a small groin incision, so the patient doesn't have to undergo a major operation, but it's done via small little incisions at the groin area. And the tubes that do contain those special grafts are actually carried all the way to the level of the kidney arteries, and deployed so that the aneurysm is excluded from the circulation. An analogy I tell patients a lot is imagine that you have a garden hose in your garage that has been sort of sitting there for many years, and then you put the water on, right? And then there's a bubble in the aneurysm. Well, one way to fix that bubble would be to take another piece of hose, if you wish, and just stick it inside the diseased bubble in the garden hose, and then there you go. The water would now flow inside the new tube, but would not flow at the bubble level anymore. So that's kind of the analogy. And it's the same basically plumbing technique that we use. We are treating the aneurysm from the inside. It does imply, though, that there has to be a seal zone on top of the graft so that there's no leakage back in the aneurysm. And that's an important feature that the current devices have to have in order for us to treat an aneurysm today.